All right, we reported this news yesterday that a medical task force is recommending that doctors stop using the very popular PSA test to detect prostate cancer. Now, according to the recommendation, the tests are not that accurate. They can lead to painful, unnecessary surgery with numerous side effects, pardon me, including clearing your throat.
You okay there, guys?
But the American Cancer Society says the recommendation is flawed and underestimates the benefits being tested. Joining us right now is Dr. Soroush Ramin. He's from St. John's Health Center in Santa Monica, in the cancer center there. This is scary stuff because PSA 20 years ago was the gold standard. If you had a bad PSA, you probably went into surgery. That's changed. What should we do now?
Well, first of all, to make a blanket statement that nobody should get a PSA test unless they ask for it, I think is absolutely a mistake. As urologists, we see every day patients with prostate cancer. Now, it's true that some patients don't need to be treated with when they have prostate cancer, but a lot of them do. And for us to misdiagnose patients or miss the opportunity to treat a patient with prostate cancer is absolutely wrong.
Because this is basically saying it's better not to know.
It's better not to know, yeah.
Well, the feeling is, and this is the generic layman's view of this, is that in the gold rush to prostate surgery, a lot of mistakes were made, and that men who would have been killed by their prostate cancer if they'd be 160
yes.
were getting the surgery when they were 62. It caused incontinence, it caused sexual malfunctions, etc.
Yes.
What do you say about that?
Yeah, it's absolutely true that there is a large percent of patients who are being treated who may not need treatment. However, the flip side of the coin is also true. There are many patients who definitely do need treatment, and if they are not diagnosed on time and they're not treated, they will die of their prostate cancer. It's really the art of medicine to determine who needs to be treated and who does not need to be treated.
But everybody needs the information.
Everybody needs the information, and beyond just needing the information, it's not that if you have an elevated PSA, that means you're going to need to get treatment for prostate cancer. There are nuances in treatment in PSA testing that help us determine who should actually get a biopsy. One thing that everybody should understand is if a person has an elevated PSA, it doesn't mean that they're going off to get treatment for prostate cancer.
It used to mean that, though.
It actually never did.
Never did?
Never did. An elevated PSA does not diagnose prostate cancer. All it does is it allows me and other urologists to determine if a patient is at risk of having prostate cancer. Now, once that determination is made, then we do a prostate biopsy, meaning we take our patient to our office or under anesthesia and we actually get a sampling of the prostate. If that biopsy shows cancer, then you decide whether the person needs a treatment or they don't need a treatment. Not everybody needs treatment when they're diagnosed. Not everybody with elevated PSA actually needs to get a biopsy.
How do you know, and this is really difficult, and it's a lot of responsibility, when it's on the borderline, you don't know, do we do something here or not?
Right.
Will he live to be 94 with this condition or not? How do you know?
Yeah, well, first of all, just going back to PSA, PSA is only a number. Only about 25% of men with elevated PSA will be diagnosed with prostate cancer. What's more important is to do a number of other tests to determine whether we really should do a biopsy on a patient with prostate cancer or not. I'm sorry, with an elevated PSA or not. So
every step of the way there should be an evaluation.
We have an elevated patients. We see patients with elevated PSA all the time in our offices. There is another test called the free to total PSA ratio. There's a test called PSA based on age.
And there is the digital test.
There's the digital test.
Still important.
That's right.
Okay.
The old-fashioned way.
The bend-over test.
Yes.
Yeah. All right, Dr. Ramin, thank you so much.
You say to the doctor in scrubs.
I appreciate it very, very much.
I have some scrubs from a